thank you guys so much for coming. We're really proud to be here, and it means a lot to us. We see you guys working out. Appreciate all the support from the bottom of my heart. Just thank you so much for coming in. This means a lot. So this is kind of the kickoff of some of the health talks that we want to bring to the community. We're kind of showcasing the Performance and Wellness Center. We have a fantastic staff, and we're trying to showcase what they are trying to teach you, and we're trying to bring experts in to give you guys the best health and wellness information. There's so much information on the internet, and everybody's looking for the best resources to try to get healthy. And this is the whole staple of what we're trying to, how we're trying to shape this health and wellness program. So you guys built this amazing facility, and we're trying to shape it to have the best information arriving out of this facility, and that's the whole goal. The staff is a huge part of that, so I just thank you to all the staff. You guys are just helping everything. So program overview. So what is the whole purpose of our program? We want to, of course, welcome to the new 2023 season, but the goals, we're trying to educate, we're trying to empower, and we're encouraging the community to try to get healthy, and that's the whole goal. And there's multiple access points to this program, and we want to meet everybody where they're at, and everybody's at a different level, and we realize that. And we want this to be an inviting facility for everybody to come, get healthy, to get after it, to train, really whatever you need. And that's kind of the whole goal. And we want to teach you how to be healthy and fit for life. We want to teach you. And so a little bit about myself. Before I came here, I've been in graduate school since 2013. And now we're putting it all together here in the desert. And so I've taught at the graduate level. I've worked in hospital settings. I've owned my own clinic. I've worked in sports performance. And like I said, this is how we shape the entire wellness program from a fitness standpoint, but also the restorative therapies that we're also offering to the program. And so,
hey Tony, can we ask questions?
Yes, of course.
So you have your doctorate. What's your doctorate in?
So my doctorate is in acupuncture and Chinese medicine. And so I've studied in China for a month at a hospital. I was in graduate school. I have a master's degree, 2 Bachelor of Science degrees, and a Bachelor of Arts, and then my doctorate. So I have 4 degrees, and I'm considered a diplomat of acupuncture. And so, like I said, I've been a student for the past decade, and so I'm ready to hit the ground running and just to give you guys the best information and the best service. So, yeah, exactly. So, but we always say that this program is centered around mentorship and coaching with leadership, achievement, and success in mind. So especially when we're working with the kids, we're trying to mentor them as somebody to look up to, and this is also for the entire community. We're trying to be leaders in this community, and we want success, whatever that looks like, success in health, success in fitness, and that's really what we're trying to build. And so you can, this is our team here, myself, and so Asa, Kim, Eric, Tyler, Mel, Elena, and newest member to our team is Grace, our Pilates instructor. I just think that we have a really good program set up for this season and for many, many years to come. So what is the goal of fitness and training? So this is when I think about movement and exercise and what is the goal. So I always think about freedom and precision of movement. If you come train with me, we do a lot of natural movements and I want you to have the confident ability to navigate and move about the world pain-free, relaxed, and effortlessly powerful. They always say if you try to swing hard with a golf swing, it doesn't quite go as far. And so why is that? And so a secret in fitness is teaching your body the ability to relax. Relax within so you're not bound up by yourself. And so these are some of the things that we're trying to teach in our training programs. But also having the ability to bend and twist and squat, jump, and natural movements. To be able to bend and pick up your grandkids. That's a natural movement, but there's no machine that really mimics that movement. But we try to put you in situations to try to get you to navigate the world a little bit easier. And to perform any physical task without hesitation. And I think that's the real goal of training. And so everything that we do is kind of centered around this little mission statement. And so when we talk about complete health and wellness, these are the 5 categories of the program. And so we have movement and exercise. And so we always like to start everybody with an assessment, a kickstart program, and then we feed you either into our class schedule, personal training, and then cardio, and then of course performance training, which is part of our golf performance training. And so the second part is the manual bodywork therapies. So we have table stretching, restorative massage, and trigger point therapy, and of course acupuncture, body walking. We demoed that a little bit earlier, and of course the cold water therapy. And so from this menu, we're trying to piece together and customize different bullet points from this menu. And so, like I said earlier, there's multiple access points of how to get involved in this program, and not everybody wants a high intensity HIIT class, and that's fine. Then you come to the Tai Chi class or the stretching class. Not everybody wants to start with exercise because, to be frank, there's a lot of people with pain, and to be honest, you never know what people are going through, and so we want to have this complete menu to help in any which way that we possibly can. Number 3, we have diet coaching and supplements. We have in the refrigerator, we have a supplement line, so you have to put rocket fuel into the system, and so we have a really good supplement program, and we can again customize that as well. And then number 5 is meditation workshops and yoga and Tai Chi and breath work, and of course the cold water club. And that's on here twice because that's extra important. But this is when the way that I got into acupuncture is I had concussions when I played football, and so I went back to school to try to how do we heal the brain essentially, and you can use acupuncture and all of these things that we're putting together to try to optimize the body. And from a sports performance standpoint, that is the goal, is how do we maximize the potential of the body. And so we can use all of these things, and this is the complete health and wellness program that we're trying to bring to this program. Yes?
Hey Tony, I know you're not going to say it, so I'm going to ask the question. How many different members have you treated for acupuncture here in the last year or so?
I would say I have charts on 80 to 100, maybe more, to be quite honest.
Including people like Tom Lennon and others, correct?
Yes, definitely.
Yeah.
And so we've worked with, we've touched this community in many, many ways, and so it's fantastic. People are coming to the facility, and either they're working with myself and of course the staff. And so yes, we've worked with, and that's not everybody wants acupuncture, and that's fine. And so then we do massage therapy or table stretching. But this is, but yes, we've worked with so many people, and it's great. And so one by one, the goal is to get you all healthy. And so that's our goal. And so,
Hey, I'm sorry, Ed. So I know everything there except for gua sha.
oh, gua sha. So gua sha is it's a scraping therapy. So there's tools, and you scrape over a muscle, and it helps break up scar tissue, and it activates the muscle. And so think about like when you lift weights, you're putting small micro tears into the muscles. So you're causing damage every time that you work out. And then you rest, and you do restoration, and you jump in the cold tub, and then you recover. And so the idea is, even with acupuncture, you're putting a small micro tear into the muscle, and then the body is remarkable, and it begins to repair itself. So sometimes with old injuries or falls, sometimes the body doesn't know that there is an injury present in the body. So giving it a little micro tear reminds it. And so then the body brings blood and white blood cells and anti-inflammatories and water, and that's how the body restores itself. And so if we do this day in and day out, this is how we chip away at old injuries, but try to just bring vitality to the body.
But every day we have to wash it.
Just do. And so it helps. But again, it's for pain management. And so not everybody's in pain. But this is where when we initially work with somebody, we take inventory so we don't have to guess. And so from this, we design and customize it's individualized health and wellness treatments. Yes?
You also do
Yes, absolutely. And so acupuncture, one of the main things that acupuncture is studied for from a clinical research standpoint is acupuncture for back pain and sciatica. But there's also for golfer's elbow and tennis elbow and shoulder pain. And so you can use it for any aches and pains. And that's kind of how acupuncture, it's 2,000, 3,000 years old. It was originally for pain management. But now with modern science, we've been learning more applications for it for stress and for sleep, for headaches and things like this. So we're realizing that acupuncture has a more neurological effect than we had initially appreciated. And so you can use it for a whole, I think in 1967 there was a symposium in Italy where doctors came together and they researched acupuncture in Chinese medicine to try to check the validity. Does this really work or is it placebo? And they found that there is actually a physiological and a neurological influence with the needling, with some of the gua sha and the cupping. And so there is, and from ever since then, there's been a lot of clinical research money into traditional Chinese medicine and acupuncture and manual therapy. And it's similar to dry needling, same needle, little different technique. But there's clinical research money into dry needling, and so there's just different techniques, but they both have a profound effect on the body. So
Sure.
yeah.
What I was really alluding to was needling with electrostimulation.
Sure, that's a newer approach. Back 2,000 years ago, they didn't have batteries, but now we know that electricity is running through your body. We have an electromagnetic field around us, and so using the e-stim with needling tends to have an enhanced effect, and so it's great. Yes.
Is it ill-advised for someone who's had joint replacement because of the risk of joint replacement? You caught yourself,
There's always a hit to the immune system when we have a joint replacement, but with the acupuncture and the needling, it's sterile. They're one-time use, so we're not reusing needles. You clean the area, so it's very sterile. And with a joint replacement, there's residual inflammation locally, so you can use acupuncture to help manage the inflammation. And that's the whole root of disease is inflammation. And so how do we combat that? And so you can use a lot of these therapies specifically for that. So no need to, you can help the recovery process from a joint replacement with some of these things. So.
But even if we get a different problem, with acupuncture, you have to have a well-healed
Oh, sure.
replacement if they're compatible.
Definitely. And so acupuncture as a whole has an anti-inflammatory effect, and it helps to facilitate new blood circulation within your body. And so that's what an injury needs is new resources, minerals, vitamins, and new blood and water. And this is how an injury heals itself. And so this is the whole goal of acupuncture is we're trying to flood injuries with basically new blood circulation. So go, sure.
So I think there's been research done with needles for needling, and it's recent. It's shown that those needles are so small and skinny that your body can, it doesn't introduce enough bacteria to turn into an infection.
Yes, yeah, definitely. And that's not the goal. But again, they're sterile needles, so there is no bacteria on the needle. So it's.
I'm just saying, assuming that you made a hole, that something can get
Sure.
through. But it's just, they've done studies in order to try to alleviate that. And I can't remember who told me, I think one of my PT therapists, but there has actually been a study to show that there's not that risk in the needles for needling or acupuncture.
Yeah, we have to take a biohazard board exam for the cleanliness, and so that's and you do after you take the needle, you put a cotton ball there for 30 seconds to close the wound, if you will. And so, so yeah, there's international standards of cleanliness. So, I appreciate the questions. Keep them coming. But this is a great Q&A. And so again, this is the program right here. Five points, and from this we customize all of your treatments and your training programs. This is our class schedule. So we have 92 and a half classes a month because one class is a half hour. And so this is a great spectrum of training from high intensity to low intensity. And so we have the class schedules. The trainers are on the sides. We do have the Golf Strong is, and I think I have the, yeah. So this is just to highlight some of the key exercise classes. So of course our Aqua Fitness is one of our most popular classes. It's low impact. The water therapy is fantastic to strengthen the joints. Again, the water is anti-inflammatory, and again, back to this increasing blood circulation is the whole goal of exercise, and that's why you feel better, is because you get a new rush of blood throughout your system. This is our new Golf Strong program. The dates may change a little bit, but we're going to have an 8-week golf strength and conditioning program. And at the beginning of the program, we're going to do a TrackMan to track your drive distance, and then in 8 weeks, we're going to check it again. And so as you get stronger, in theory, you should be able to hit the ball a little bit farther. And don't forget that the golf swing itself is a powerful movement. And so you have to train fast in order to generate a new swing. But you have to ease into that. And so you can't start day one going 100 miles an hour. And so this is why we want to design an 8-week progressive program over the course of the season to get people plugged into this. And this is our whole, we're trying to increase distance, increase power, but also to improve mobility so you can play, and endurance. It's a long 4-hour round of golf, and that's endurance in that as well. So this is part of our yoga, our stretching. Of course, we've had some of the breath work. This was last year when we did the gong meditation in the courtyard. Was anybody at that event? Yeah. And so it was quite an interesting event. I don't know. We attracted all the birds into the, and so it was like, and right before it started, it got really windy, and so we were stirring something up right at the beginning of the season there, and so we want to do it again, but it just, you never know what's going to happen. So, but that was a really unique hour and a half. Of course, we have our yoga program with Elena, and so this is some pictures of treatments with the acupuncture, and so my professor always said, don't show this because it's needles in the body, so if you're a little busy, this is what it is. But this is from my Instagram page back in Milwaukee. And so the needling, this is cupping, and this is, in Chinese medicine, we always look at the tongues. And so you can look at what the tongue looks like, and that can indicate some, what the condition of the inside of the body looks like. And so this is a scalp treatment. This was a treatment for headaches. This is for carpal tunnel. This is a low back treatment here, and I have the E-stim hooked up to that. So this is a woman that fell and actually broke her neck, and so she had a huge scar along here. And so you needle along the scar, and it helps to break up some of the scar tissue. This is a knee treatment, but this is just kind of a snapshot from my old Instagram page, just to kind of show what does a treatment look like. And we had a request for an acupuncture demo, but there's no sparks, there's nothing really. It's not magic, and it's not a trick. And so what you do is with these treatments, you just sit for 15 to 20, 30 minutes with the needles in, and it's like a little lightning rod. And so again, your body's running electricity through your body, and the needle interacts with the electromagnetism in your body, and that's a way that it has a neurological effect. And so this is this is what acupuncture looks like. It doesn't always look like this, but it's very subtle. Some of these are a little bit more aggressive treatments and things like that. But this is a little bit about what some of the treatments look like.
Good question.
Of course.
So is the whole trick here, is there acupuncture for people who are grown?
Yes. Yeah. There is a hangover treatment. So we call that alcohol toxicity. Alcohol puts heat everywhere in the body, and so what happens with the hangover? You feel swollen, and so the body heats up after a night of drinking. And so the acupuncture has an anti-inflammatory, and inflammation is always hot. And so there's ways that we can, the goal is to try to clear heat out of the body, to cool it off, and to manage, again, back to managing inflammation. And so, and yes.
Yeah, is it true in China they actually do surgery without anesthesia with acupuncture? Is that correct?
Yes, it is correct.
To me, that says more than anything else, this stuff does work, because, I mean, that's the ultimate, really. when
We
you
don't
think
hear
about
about China.
No, but, yeah, definitely,
Right.
yes, it has a numbing effect. And so again, when we talk about pain, it acts as a pain blocker. I think I would rather take the anesthetic personally, but it has been done. And so when we talk about managing pain, yes, it
Have
is
you ever
part
been
of
to
the.
China?
Like 12 times.
Yeah, and
Yeah,
one
okay.
time.
So, it's a lot.
Enough.
And yeah, so the next part is the diet and supplementation. And so we really want to emphasize the importance of nourishing the body. The body runs on 90 different vitamins and minerals. It runs on water, the electrolytes, salt, potassium, magnesium. These are all things that we're supposed to be getting from our food. Unfortunately, our food sometimes is a little empty, so we always encourage at least take a multivitamin, magnesium. We have an essential list of 5 different things that we recommend. And if the body is malnourished or running on fumes, this is where we kind of get headaches, dizziness, and fatigue. If your body doesn't have the resources to power the engine that it is, we feel it, to say it simply.
Tony,
yes.
if you were just to take one vitamin only, what would it be?
Magnesium. Yeah, magnesium and a multi, probably at the very, very basic. I think the study was 80% of the country is magnesium deficient.
Oh, really?
And there's many forms of magnesium. And so the magnesium I take has 8 different magnesium forms in it. So you kind of need a little bit of both. But magnesium is such an important electrolyte. If I had to pick one, which is hard to do because there's 90 of them.
Yeah.
Magnesium, a multivitamin, and there's something that's called fulvic acid, which is a trace mineral. And I would say those are my top 3 things that I really recommend. And it helps, and of course water.
Oh, yeah, lots of water.
So you are water, and so don't forget about that. And so, surprise, surprise, circle all the way back. So this is where we'll have the cold water at tubs set up by the ranch house. Reduces muscle soreness, anti-inflammatory. It does improve your immune function. And so by going into extreme cold, it does stimulate your immune function. It does improve sleep. Back to this improving blood circulation. And so we'll have windows of time. We'll have this set up down by the ranch house. And so that's a little rundown of our programs. We wanted to showcase a little bit about what we're doing here in the Fitness and Wellness Center. Yes?
Tony, I missed a couple of your cold water clubs. How often are you doing that?
That's Wednesday and Friday for the time being. We set them up
Every week?
Every week from 9 in the morning till 3 in the afternoon. If people trickle in at the end, that's fine too. But it's a window of time, and we have different ranges of the temperatures. So we have a cold tub, and a really cold tub, and a really, really cold tub. So you can kind of see how that is. It's interesting, when we had this the other week, and we had these different temperatures of water, and everybody's always timid, and let's just try the 60 degree. And then they went and jumped in the pool, and then by the end of the session, everybody jumped into the 45 degree one. And you don't have to stay in there very long, but again, it's this shock to the system. But you ease into it, and this is why we do breath work, so you have the tools to help you endure. And it helps you, because it's going to take your breath away. So you have to know how to breathe. But when you jump in here, that's not the time to learn how to breathe. So we do it ahead of time. And so the cold water and the breath work is crucial. Yes.
Yeah, Tony, I didn't realize this until I saw the data and all that, but I'm sure most people here don't realize it. How many unique membership visits are you having on a monthly basis to this club now?
Sure.
The fitness.
Tyler does all the stats.
It's like 440 is kind of what we're looking at.
So
Yeah.
it's 440 different people coming through the facility each month.
All members. Yeah.
50 to 70 guests.
Yeah.
Yes.
So yeah, so it is unique. People are using the facility, and this is the framework and the crux of our program. The trainers are a very crucial part of that, and myself, and this is the direction that we want to take this program. Of course, this is your club, and I'm your director of fitness and wellness. But this is what I'm trying to bring to the community here, and so. Go ahead.
Follow-on question is, how many total members, how many total visits do you have?
Like 2,400.
A month?
Yeah.
Yeah.
Mhm.
2,400
Yeah,
visits a month.
in the
is
busy
right now.
in the busy season. Yeah,
You're
this will be
talking
the start of it.
Here,
So,
right here,
oh, that- the
this
club
facility,
itself, okay.
and that has come light years from where it used to be.
Oh, well,
Due to this guy and his staff.
I'm very proud to help you in any which way that we can. This is a picture from yesterday. Follow us on Instagram. This is from Happy Halloween yesterday. We all dressed up yesterday, and it's just training and health should be enjoyable. If it's a grind every day, that doesn't help. So yes.
Hey, quick question, Tony. So what would you recommend like on a monthly basis? Like, would you recommend like a monthly acupuncture every week you do the ice plunge?
You can always benefit from restorative techniques, and so this is where the customization comes in. But we always recommend to go through a series of treatments, maybe 5 to 10 acupuncture treatments to get into a rhythm. And then this is combined with the training and the personal training. And then you start to space out the treatments maybe every other week and then once a month. And then if something comes about, an injury or something more complex, then we apply more treatments. But we always recommend train every 48 hours, every 48 to 72 hours. I don't recommend to work out every day because you're like a battery. And so you need the recovery, you need the off days. And so work out, recover, and certainly the treatments are there as well. So it's always hard to say, but an acupuncture protocol is 5 to 10. We're going to get massage therapy in the coming months, which we're really excited about. We do have a new treatment room downstairs for some of the therapies, and this is what we're trying to piece together. So, yes, go ahead.
Is yoga for women only?
No, definitely not. Exactly. So many athletes are utilizing yoga from a performance standpoint, and so no, absolutely not. It's for everybody, and that's the whole program is for everybody, men and women. And so we want to emphasize that. Yes, please. We do have a red light therapy, and so that's part where I'm using it in all my treatments now, which is seeming to have an enhanced effect. And so again, if you zoomed in all the way to your cells, your mitochondria are making light, sparks, like ATP. When it splits, it gives off a spark of energy, and that's light. If you break it down that way, and so somehow light therapy that is able to penetrate into the body seems to have a neurological effect. It helps with blood circulation, anti-inflammatory. And so we do have a new red light therapy. It's medical grade, but we are using it in with our treatments as well.
And it works.
Thank you for listening. But okay, so really, guys, thank you so much for sitting through this. We want to have these health talks once a month, and hope you enjoyed it. And just any questions, reach out, fitness, talk to the trainers, talk to us, and we're here to help in any which ways.